and rapid response teams. And also the Ministry of Health has indicated that the country has reported no Ebola cases, but also remains on alert because of regional travel links. Now, still on that particular issue, the government or the Ministry of Health has, in many occasions, or is on record defending that particular position, or arguing that Kenya also faces a genuine risk from Ebola outbreaks, that is in neighboring Uganda and Democratic Republic of Congo, and that investing in isolation facilities and surveillance and also emergency response strengthens the country's long-term health security, and also the facility that is part of broader preparedness efforts and is not necessarily intended only for Americans. However, these are concerns that, as I had indicated earlier to you, these are the issues that, as the National Assembly sits this afternoon, the Cabinet Secretary, once he appears before the House, will be able to clarify on these matters. The public outcry that has been there is that there have been concerns around that particular facility perhaps could increase the biosecurity risks and strain Kenya's public health system. Also, there have been concerns around there have not been any or adequate consultation with the public regarding that particular arrangement. And also, there have been concerns around the national sovereignty on this particular issue, also constitutional concerns there about. Several medical groups have been coming out to publicly oppose that plan and warning that the Ebola strain involved presents serious containment challenges. So basically, these are concerns or public a matter that once the Cabinet Secretary appears before the House, the concerns or questions that the members of the public could be having out there, then the members of the National Assembly shall be able to raise this particular matter with the Cabinet Secretary, and those concerns shall be cleared. The Cabinet Secretary shall be able to clear the air on those particular concerns. So that is part of the priority business that the members of the National Assembly this afternoon shall be focusing on. And back to the considerations of the budget estimates from the financial year 2026-2027. There have been allocations that have been done to various offices. Remember, the total government expenditure, the total national government expenditure is at a total sum of 2,930,216,013,184 from the consolidated fund to be able to meet expenditure during the year that is ending the 30th of June, the year 2027. Of course, this marking the next financial year from 2026 to 2027. This, of course, comes from the total budget of the country for the next financial year that is standing at a total of 4.850 trillion Kenya shillings. So we shall take a look at some of the allocations. The Executive Office of the President has been allocated 7.49 billion, with development standing at 1.3 billion and 6.1 billion standing at recurrent expenditure. The Office of the Deputy President has been allocated 3.5 billion. The Office of the Prime Cabinet Secretary has been allocated 1.139 billion. State House has been allocated 13 1.443 billion Kenya shillings. Matters security, the National Police Service has been allocated 147.410 billion. Monies that shall be going into the National Police Service.
Honorable members, Mr.
The
Speaker.
State Department for Technical, Vocational and Education and Training has been allocated 58.489 billion. Higher education also has received a bigger share, that is 163.9 billion Kenya shillings. Basic education also has been allocated a bigger share, that is at 136.5 billion Kenya shillings. The Speaker of the National Assembly, Honorable Dr. Moses Masika Wetangula, as you can see, he's making his way into the House, or has already made his way into the House to preside over this afternoon sitting. You will allow me to hand you over to the live broadcast of this National Assembly proceedings this afternoon. Good afternoon.
Mheshimiwa, tuombe. Ewe Mwenyezi Mungu ambaye kwa hekima na wema wako umetoa nyadhifa za viongozi na mabunge kwa ustawi wa jamii na utawala wa haki wa wanadamu, tukusihi utazame kwa neema nyingi sisi watumishi wako ambao umeridhika kutuita tutekeleza shughuli muhimu za jamhuri yetu. Tukuomba uteremshie baraka zako sisi tuliokutanika hapa na utujalie tuyatende na kufikiria mambo yote yatakayofikishwa mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe na ili kustawisha amani, ufanisi na heri ya nchi yetu na wale ambao haja zao umezikabidhi mikononi mwetu. Amen. Honorable members, we have quorum. I must congratulate you today for coming in good numbers at the beginning. We'll proceed as follows. We are entering the second allotted day on consideration of the budget estimates. As you know, under our standing orders, there are 3 allotted days. An allotted day under your standing orders is 3 hours. So you did one this morning. We are going to take 1 hour from now to deal with the issue that has brought the CS for Health, Honorable Duale, on the Ebola issue. When we finish with Honorable Duale, we'll go to the second allotted day. That second allotted day will run for 3 hours. And there will be a seamless transition to the third allotted day that will run up to probably 10:30 tonight. That will be the end of the allotted day, so that tomorrow you go straight into committee for thorough examination of the budget. So we will start by Majority Leader, look for and find the CS and bring him to the chamber.
Order number 1, administration of oath. Order number 2, communication from the chair. Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Acknowledgement of children. And who was on the floor? Members, as we wait for the Honorable Duale, we'll save time by proceeding with the motion at order number 8. But before that, allow me to acknowledge in the Speaker's Gallery St. Mary's School from Narok North, Narok. Acknowledge your children, members. In the Speaker's Gallery also there's Kihumbwini Girls School from Gatanga, Muranga. In the public gallery, we have Kinyogori High School from Limuru, Kiambu. We have St. Mary's Nyabururu School from Kitutu Church, Kisii. And St. Bridget Siomunyu Girls from Kitui Rural, Kitui County. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to the House of Parliament. Okay. Bring in the minister. Is he here? Yes. I can report to you. Okay. Yes, Majority Leader.
Honorable Speaker, thank you. I have diligently looked for the CS and finally found him. And he is in the House, and I would like to cordially present him to you so that he can start the business of the day. Thank you, Honorable Speaker.
CS for Health, Honorable Duale, you're here on the direction of the Speaker to speak to the House and the country on the issue of Ebola and the raging debate about it. This session will be exactly 1 hour. This is an allotted day. It is now 2:46. At exactly 2:46 members, we will stop. 3:46, we'll stop on this issue. So we'll allow the minister to deliver the statement to the House. Thereafter, I'll allow comments, questions to the minister. And at 3:46, we'll discharge him to go back to our allotted business. Minister, welcome.
Mr. Speaker, honorable members, I thank you, Honorable Speaker, for giving me this opportunity to appear before this House and to provide a report on Kenya's preparedness and containment and management of the threat posed by Ebola virus disease, following your directive during the plenary sitting of the 2nd June 2026. I also acknowledge the concern raised by honorable members regarding the possibility of Ebola virus disease importation into the country, the establishment of a quarantine and isolation centers in Kenya, the preparedness of public health facilities, and the nature of the regional and international coordination mechanism. From the onset, I wish to assure this House and the people of Kenya that the country has not recorded any confirmed case of Ebola virus disease as of 3rd of June 2026. The government is, however, treating the regional outbreak with the seriousness it deserves, because Ebola is a severe disease with high fatality and huge public health threat. And Kenya's position as a regional aviation, trade, transport, and diplomatic hub places the country at increased risk of importation of the disease. Honorable Speaker, the epicenter of this outbreak is in DRC and Congo. As per our last situational update, the Democratic Republic of Congo has reported 1,083 suspected cases and 259 deaths. Of these, 321 cases are laboratory confirmed, with 48 confirmed deaths. A total of 2,746 contacts have been listed for follow-up. Uganda has reported 12 confirmed cases and 2 deaths, with 642 contacts listed for follow-up. Honorable Speaker, this disease is associated with the Bundi species of Ebola virus. This is significant because there is currently no approved vaccine for this particular virus or for this particular species. The outbreak has also affected healthcare workers both in DRC and in Congo. In view of the regional risk, the WHO declared the outbreak as a public health emergency of international concern on the 16th of May 2026, while Africa CDC declared it a public health emergency of continental security. These both declarations by WHO and Africa CDC signals an extraordinary public health event that poses a risk to other countries and requires a coordinated international response. Kenya has therefore activated the National Preparedness System in accordance with our constitutional duty to protect the right to health, our obligations under the Health Act 2017 and the International Health Regulations 2025. Honorable Speaker, before I respond to the many questions that you have asked me to answer, let me just give the country what is Ebola and which type of Ebola is this. Ebola is a severe, often very fatal illness in humans. There are 3 different types of species. There's Ebola, Zaire, Sudan virus, and the current one we have, which is called Bundibugyo virus, which has the capacity to cause large outbreaks. The modes of transmission are many, Honorable Speaker and members. The infection index from contact to the wild animals. Thereafter, transmission occurs from person to person through blood or bodily fluids from infected persons or dead bodies. Transmission can also occur from contaminated surfaces or objects like bed linen and clothing or unsafe injection practices. What are the early signs and symptoms? The average incubation period of this particular virus, Ebola virus, is between 2 to 21 days. Infected people are not contagious until they develop the symptoms. Initial signs and symptoms are non-specific. Many common infections, like other diseases like malaria, typhoid, meningitis. But the symptoms are usually of a sudden onset. They include fever, chills, headache, joint pain, muscle pain, backache, nausea, vomiting, diarrhea, fatigue, weakness, skin rashes, among others. Bleeding is less frequent and can occur in the later stages of this disease. Who is at risk of infection? Travelers to the affected countries like DRC and Uganda, contacts of travelers from the affected region, family members of the Ebola virus diseases, healthcare workers taking care of the patients with Ebola, or people handling bodies of Ebola victims. How do we prevent Ebola? Early identification and prompt referral and isolation of the suspected cases. Basic universal precautions of hand hygiene and gloving in health setups during the routine work. Wearing of the full personal protective equipment when handling cases or suspected or confirmed Ebola. And finally, to avoid contact with the bodily fluids of suspected cases. Honorable Speaker, allow me now to address the questions that appeared on the letter you addressed, and the first one was the measures by the government to manage and contain the threat of Ebola. Honorable Speaker and members, the government has activated a whole government preparedness and response framework led by the Ministry of Health through the Kenya National Public Health Institute. The National Ebola Incident Management System was activated on the 20th of May 2026 in order to provide a unified central command, coordination, and decision-making. This structure is supported both at the national and county public health emergency operation centers, which remain on high alert mode. 2, under this arrangement, we have also strengthened our surveillance of health facilities within our communities and the points of entry. We have issued advisories to all the 47 counties covering Ebola case definitions, infections prevention, control reporting protocols, guidance on isolation, sample referral, contact tracing, among others. Our rapid response teams, Honorable Speaker, have been placed on standby for deployment where alerts are reported. Government has also enhanced screening at our 26 official points of entry, including our international airports, land border crossings. As of yesterday, 2nd June 2026, 71,243 travelers have been screened cumulatively, including the 2,506 travelers who were screened in the last 24 hours. Screening focuses particularly on travelers from the affected countries and high-risk travel routes. To date, Honorable Speaker, the national surveillance system has captured and investigated 22 suspected alerts from across the country. All of them have tested negative. These alerts were reported from Nairobi, Kiambu, Uasin Gishu, Nyeri, Nakuru, Nyamira, West Pokot, Kisumu, and Bungoma. In the last 24 hours, 3 alerts from Nairobi, Uasin Gishu, and Bungoma were investigated and they were confirmed negative. Honorable Speaker, the Ministry has also operationalized the public communication mechanism, including the national number, toll number 719, which is our public health hotline, to facilitate communities to report, to do public inquiry, and to give health advisory. Public messaging is being disseminated through the national and the county channels in order to educate the public on the risk factors. Honorable Speaker, the second area you told me to address through the letter from Parliament was the preparedness of the public health facilities, the isolation units, the medical facilities, and trained personnel. Honorable Speaker, the House specifically requested a report on the level of preparedness of public health facilities, including isolation units, medical facilities, and trained personnel. And I want to confirm that the Ministry of Health has undertaken facility readiness assessment and continue to strengthen capacity at the national referral facilities and in counties considered at high risk. At the national level, Kenyatta National Hospital has prepared an 8-bed isolation and treatment unit and completed a dry run of how the index case will be handled. The facility has a separate waste management system to support the safe handling of infectious waste. The National Police Service Hospital has been assessed and has 49 beds ready for activation as part of the surge isolation capacity. At the county level, 29 counties have identified designated isolation and treatment sites. The Ministry of Health, the Kenya National Public Health Institute, and relevant regulatory agencies are undertaking on-site verification, quality assurance, spot checks to confirm that these facilities meet the required standard for infection prevention, control, patient flow, waste management, staff protection, and emergency referral. Honorable Speaker and members, these facilities are part of Kenya's national public health preparation architecture. They are not established for exclusive benefit of foreign nationals, foreign governments, or any special category of persons. They are intended to protect all persons within the territory of Kenya, including Kenyan citizens, residents, refugees, visitors visiting our country, diplomats, expatriates, and any other person who may require isolation, testing, or treatment based on the medical need and public health risk. This position is consistent with the Constitution, the Health Act of 2017, the Public Health Act, and the International Health Regulation 2005. If any person is identified within Kenya as a suspected or confirmed Ebola case, the correct public health response is to safely isolate, test, treat, and trace contacts within the jurisdiction where the risk is detected. On personnel readiness, Kenya has mapped a surge capacity of 241 expert responders comprising of 51 epidemiology and laboratory training program, 118 African volunteer health corps professionals, 72 basic health emergency management specialists, and these teams are on standby for deployment to support surveillance, contact tracing, case investigation, laboratory diagnosis, and field responses. Additionally, 1,069 national and county health workers have been sensitized on Ebola preparedness and response through a very structured virtual sessions. On-site training and simulation drills have been undertaken in Busia County and Busia border, where 60 health workers have been trained, and additional exercises are going on our plan for the county of Turkana and Trans Nzoia. A national tabletop exercise is scheduled for 15th to 18th June 2026 to test coordination, referral, laboratory, and response. Thirdly, Honorable Speaker, you have asked the measures we have activated as a ministry, which I have really enumerated. Honorable Speaker, in surveillance, the health facility and community-based surveillance have been intensified. Ebola case definitions have been distributed to all counties. Rapid response teams remain on 24-hour standby. Counties have also been directed to identify and operationalize isolation facilities, holding areas, and quarantine facilities. At our points of entry, screening has been strengthened through health declaration requirements, temperature screening, symptoms assessment, and referral protocol. Thermal scanners, holding rooms, ambulance systems are being reviewed and activated in all our priority ports of entry, including major airports and high-volume land border points. On our laboratory preparedness, the virus being an extreme biohazard, 4 laboratories have been designated for Ebola testing. The National Public Health Laboratory, Kemri Nairobi, and Kemri Kisumu, and a mobile laboratory deployed to Busia. These laboratories are equipped for molecular diagnosis with a mobile laboratory positioned to reduce the turnaround time in the border region. However, Honorable Speaker, I wish to be very candid with this House. While laboratory capacity is strong, the current stocks of specialized test kits, reagents, personnel protective equipment, which are estimated to support only approximately the first 200 suspects, are in place now. And this is why additional emergency financing and partner support are required to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available in the country and being prepositioned to support preparedness activity. Initial preposition is focused on strategic sites, including Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. Honorable Speaker, the fourth item was on regional cooperation, coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the US Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of Government to establish a quarantine facility for US citizens or foreign nationals, I wish to state it clearly that Kenya and the US government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015 during the state visit of our President and President Barack Obama. President Uhuru and President Barack Obama. The agreements were therefore approved by the cabinet then in April of 2016 and subsequently introduced in this House in Parliament, laid on the table of the House on the 19th of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which the annex I have provided. The extended agreement has a validity period of 7 years and is valid to the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Airbase is part of the 23 similar units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the US government under the command of the Air Force Commander, the base commander, and the entire medical team of the Kenya Defense Forces, working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with the capacity to offer specialized care for complex infectious diseases like Ebola. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker, the House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in DRC under the MONUSCO peacekeeping mission. Any of these Kenyans could be exposed and could require a quarantine and isolation facility back home in Kenya. The government has established undesignated isolation and treatment capacity as part of our national preparedness. These include, I said, our national referral facilities, our county designated sites, temporary holding areas for points of entry, county isolation facilities. These facilities are being progressively verified for quality, for safety, and for readiness. And I want to reiterate that all such facilities are established for the protection of the people of Kenya and all persons within the Kenyan borders. They are not only foreign facilities, they are not for foreign facilities, they are not exclusive facilities, they are not facilities reserved for any nationality, they are public health assets established and coordinated under the authority of the government of Kenya. In the event of a suspected case, the response will be guided by medical triage, exposure risk, clinical need, and public health protocols. A Kenyan citizen, a foreign national, a refugee, a diplomat, an expatriate, or a traveler will be managed according to the same public health principles: safe isolation, testing, clinical care, contact tracing, prevention of further transmission. Our objective as government is to protect communities, to protect healthcare workers, and the country. When a case is detected, the safest place to manage it is within a properly equipped isolation and treatment facility under the controlled conditions. Finally, Honorable Speaker, you have told me to give guidance on the public health guidance. Honorable Speaker, any person who develops fever, headache, vomiting, diarrhea after recent travel to the affected areas or one of their community members after contact with a suspected case should seek medical attention immediately and report through the 719 public health hotline. Honorable Speaker, our readiness assessment gaps and resource requirements are all provided in this document, and I think I have provided the agreements, the documents, but just to conclude so that I take questions from members, Honorable Speaker and members, it's very important, you play a very important role in the public health protection of our country. Misinformation during disease outbreaks can cause panic, can cause stigma, can delay health seeking and resistance to public health measures. I therefore request members of this House to support the Ministry of Health by amplifying accurate information, encouraging early health seeking behavior, supporting screening at border points of entry, and urging the public to use the official 719 hotline. Honorable Speaker, I want to repeat for emphasis, Kenya has no confirmed case of Ebola virus disease. Our surveillance systems are active. Our laboratories are functional. Our points of entry are screening travelers. Our rapid response teams are on standby. Our health workers are being trained. Our isolation facilities are being verified and strengthened. And the government of Kenya remains fully in control of the preparedness and the response architecture. Our approach is guided by science, the law, the national interest, the public health protection, and the international obligation that as a country we have. We will continue to act transparently. We will continue to act decisively. We will continue to respond responsibly in order to protect Kenyans and all persons within our borders. I thank you, Honorable Speaker, and I'm ready to respond to any questions from the honorable members.
Thank you, Honorable Duale. Sarah Korere.
Thank you, Speaker. Speaker, we've had a very elaborative explanation from the Cabinet Secretary. And Speaker, coming from Laikipia, we have a lot of reservations, and especially concerns from the people we lead, because we are representatives of the people. Speaker, it is clear that this Ebola is rare and fatal disease. And common sense will dictate that if this disease starts in a particular place, it will be natural that you just contain it where it has started. I want to ask the Cabinet Secretary. He has said that the government of Kenya and the government of the US signed an agreement way back in 2015. And in 2019, there was Corona, which was a global problem. We didn't see the US come out, the way they have come out now, to construct a Corona isolation center or a center to help the Corona people who are infected by Corona in Laikipia or anywhere in this country. And if they have, probably the Cabinet Secretary can tell us. About this Ebola thing, I want to ask the Cabinet Secretary. You know, it's very unfortunate that we saw a US Secretary of State in Washington declaring that they will not allow even one single case of a corona-infected US citizen, I mean Ebola, set foot in America. So if they're infected in Congo, they will not take them to treat them in America. They will not treat them in Congo. They will bring them to Laikipia. And you know, members, allow me to say this. You know, the people of Laikipia, we have never healed from the aftermath of colonization. We still feel that even today we are still being colonized, because half of our land went to the British colonizers, and it later on went to their citizens, and we have never regained a single inch of the ranches they took from us. And now, they want to bring Corona. And you know, I mean Ebola. And you know, I'm just saying because I represent people who are concerned that if Americans are to be flown to Laikipia Airbase to be treated there, what happens if this disease, God forbid, you know, leaks out and probably people around Nanyuki are infected by Ebola? Will the American government take charge and treat the Kenyan citizens the way they would like to treat the American citizens? That is one.
You've made your point. There are many interests,
let
Sarah.
me finish.
I can't allow you to
Finally.
continue making a speech.
I'm finishing. Finally, the concern also is we have a lot of tourism in Laikipia. And as I speak now, there is a lot of cancellations by the people who are traveling to the lodges of Laikipia. Can the Cabinet Secretary tell us how are they going to communicate to the citizens? Because probably most of this mayhem is because of miscommunication. Whose message is it that the citizens are getting miscommunicated by people who are not in authority to give that information to them? Why should the people who are in authority didn't give the correct information to the citizens of Kenya and the citizens of Laikipia?
Thank you, Sarah. Mere Mase. Avoid the temptation to make speeches. Ask questions.
Thank you,
Yes.
Honorable Speaker. Honorable Speaker, and I thank you for giving me this opportunity because I'm from the border to Uganda, and my people are more at risk. My question is, I have listened to the PS, to the CS, I'm very sorry, to the CS. I have a concern. The ministry officials were in Busia County, Teso South at Alupe Hospital with a proposal to convert Alupe Hospital into an isolation center for managing Ebola. Honorable Speaker, I do not have any other hospital to serve the people of Teso South. None. It is only Alupe Hospital. So I want to tell the CS that we will resist that Alupe Hospital cannot be made an isolation center for Ebola. Whereas I support the government initiative for preparedness to protect the people of Busia because we are at the border, let another venue be identified to build that isolation center. But Alupe will not be converted, Honorable Speaker.
Robert Mbui. Minister, I hope you are recording the members and the questions.
I have to.
Mbui.
Thank you, Mr. Speaker. Mr. Speaker, listening to the CS, he was very clear when he said that Kenya has no cases of Ebola. And Mr. Speaker, the ministry should endeavor to ensure that Kenyan citizens are safe, because that is the purpose of this ministry. Now, we know that Ebola is highly contagious. There is this agreement that he says there is, because of sub judice, he cannot maybe table it before us. But Mr. Speaker, I want to ask him to just clarify. In that agreement, which is between Kenya and the US...
He didn't say that. He didn't say he cannot table. In fact, the
because
agreement
he has not tabled, Mr. Speaker.
The agreement is here.
Oh, we have it, okay.
Yes.
Or the court case, the matters
he said
that are
he will not
contained
delve
in the
into
court
matters
case.
sub judice.
So, Mr. Speaker, I wanted to just find out, where in that agreement does it say that we can expose Kenyan citizens at the expense so that we can be able to save citizens of the US? It's very important that he points out that, because in my opinion, I think that cannot have been something that this House would have passed. And Mr. Speaker, finally, I also want him to clarify, is it true that this center that is supposed to be built in Mount Kenya region is supposed to be only meant to be used by US citizens and not Kenyans? He needs to clarify that for us. Thank you, Mr. Speaker.
Yes, Dindi Nyoro.
Thank you very much, Honorable Speaker, for this chance. And direct to the point, I have listened to the CS, and there is actually no space in his speech about the view of Kenyans. I'm yet to meet one single Kenyan who is in support of having this quarantine in Kenya, Honorable Speaker. And it is important for the government to know that the government exists for the welfare of Kenyans. And Kenyans know when their space is being cropped, Honorable Speaker. Honorable Speaker, the US budget in terms of health is 860 times ours. Their technology is better in all respects, including biotech, Honorable Speaker. They have better capacity to handle these kind of issues than Kenya. Honorable Speaker, while the CS is here, I would request him. Kenyans have spoken in one voice. We do not want that facility of Ebola here in Kenya. Please listen to the Kenyan voices. And Honorable Speaker, as the CS is here, the CS should actually bite himself and the obligations to what the Kenyans are looking forward to. Lastly, Honorable Speaker, in terms of the fragility of our health sector, and also listening to some officials from the US proclaiming clearly that they do not want any case of Ebola in their country, how reckless would the government be in doing exactly the same that which the country that is the US do not want in their soil? As Kenyans, we refuse. The government must listen to Kenyans and desist from having this quarantine in Kenya.
Yes, Mama Zamzam.
Asante Mheshimiwa Spika, na mimi pia niweze kumwelezea waziri, ndio Ebola na kujitayarisha ni kitu kizuri sana, kwa sababu hawa ni majirani zetu, wengine wanatuuzia kahawa umumu, wengine wanafanya nini, lakini iwe ni kama kukinga wa Kenya peke yake, waziri. Lakini waziri, ikiwa, na mimi nataka niwaambie hata wale wabunge walikuwa hapa, kwa sababu inasemekana hiyo ilipita hapa bunge hapa, na Ndindi Nyoro ulikuwa hapa kwa hii bunge. Kwa hiyo ni vitu ambavyo mngeweza kukataa wakati ule, ili isiweze kupita mumpatie rais wakati mgumu. Waziri, mimi napenda kusema tu, kama Mwamerika amekataa kule kwake, hapa Kenya tukubali, na nasikia katika counties 20 ambao walikuwa wamekubali, Mombasa ilikuwa moja wao. Kama mama Mombasa, sitaki kuona mzungu kule anatibiwa Ebola. iwe kama itajengwa ni ya kuangalia watu wetu peke yake. Waziri, sisi ni kitu kizuri na tuna support kama tuwe na preparedness, manake sisi ni majirani, huwezi jua, na wanasema ina spray na unyevunyevu either through sex ama maji ama mate, hizo vitu tumesikia, lakini sasa lakini sasa huwezi jua kitu yote za kutokea. Mheshimiwa Spika, kitu chochote chaweza kutokea. Na ikitokea iwe ni sisi wa Kenya peke yetu, isiwe kuwa ni mtu mwingine anakuja kutibiwa hapa, waende kwao ama warudi Kongo kule walipata ugonjwa watibiwe Kongo. Asante sana Spika.
Yes, Ichungwa.
Honorable Speaker, first I don't know whether Honorable Zamzam, but the Deputy Speaker tells me Honorable Zamzam is actually right because the Minister did speak about... But that's what the
Minister said.
Bodily fluids.
She simply said what the Minister said.
So bodily fluids could be transmitted in many ways.
The Minister didn't speak in such good Swahili. Or at all.
So thank you, Honorable Speaker. Honorable Speaker, let me first begin by thanking the Minister for this statement, because as Honorable Sarah Correa has said, is indeed very elaborate. And also to note, Honorable Speaker, that at the time this agreement was tabled in this House, I highly suspect the Honorable Aden Duale, as leader of majority, is the one who tabled this report in 2015. And the subsequent one tabled in 2022 was tabled by the Honorable Kimunya, my predecessor, as leader of majority. And it is true that the agreement between the Republic of Kenya and the United States was tabled, debated, and ratified by this House. And therefore, even as we speak, I know there's a temptation, Honorable Speaker, to speak to the gallery. And I wanted to begin by asking the CS to clarify just one thing that he has already said in his statement, but which many of us probably did not hear, or we have blocked our ears from hearing it. And because I have the privilege of having a copy of this statement here, Honorable Speaker, the CS did state that the proposed Ebola treatment and isolation unit at the Laikipia Airbase is part of the 23 similar units to be established in the country as part of our preparedness and response. So I would want first CS clarify to us and to the country that we are not establishing one isolation center. Two Honorable CS, including some of the ones, the Minister did name a few, including one in Busia, was it Alupe or somewhere?
Order, gone.
Two, Honorable Speaker, I want the Minister to clarify to us and to the country something again that he has said in this statement, that this isolation center is not being established for foreigners exclusively. The Minister has said that we have 2 Kenyan banks with Kenyans, our sons and daughters working in the DRC, some in Uganda. We have 450 of our armed men, our armed officers, who have given their lives to protect our lives in this country and the region, our region of peace. Should any of those 450 of our officers, our sons and daughters in DRC, God forbid, catch the Ebola virus, where shall we take them? Do we take them to America? Do we leave them to die in the Congo forest? Or do we establish isolation centers as any responsible government and administration would do to make sure that should you, Honorable Speaker, this weekend, I traveled to Rwanda. Honorable Speaker, I traveled to Rwanda as a Kenyan.
Yes, Millie, what is
Any
the point
other
of order?
Kenyan would have traveled to Congo.
Yes, Millie.
Sorry, Mr. Speaker, I had to interrupt the majority leader, especially now that I'm in leadership of the broad-based. But I'm just wondering, is the honorable member in order to imply that the United States of America is irresponsible by not setting up their own facilities in America? Because Kenya is responsible setting up one in Kenya. Are you in order implying that America is responsible by not setting up in their own country when they are a superpower and we are a minion power? Are you, even Honorable Buru is still looking for power and you are bringing, are you suggesting that America is irresponsible by any chance?
Honorable Miller, are you saying that America is incapable of being irresponsible?
Mr. Speaker, I am actually asking for clarification. I am not saying, yes. Mr. Speaker, I plead the Fifth Amendment. I just want to know from the...
Okay.
Honorable Speaker, in direct response to my sister, Honorable Millie, I am very well versed with our standing orders. I would never allude to the irresponsibility of a friendly nation on the floor of this House. I will not do that. But my point was, Honorable Speaker, back to my point, that as a responsible country, should we or should we not have isolation centers? Because this disease, we can't run away from the fact that it is there, and it is there in our neighborhood, in this region. Therefore, the question that I wanted the CS to clarify, yes. And I'm saying this, Honorable Speaker, deliberately in a leading manner, so that the CS clarifies for us and for the nation, this isolation center, from what I read in his statement, you know, Honorable Speaker, the problem is that members don't listen, like the member for Aldai is making noise and distracting me. And that is why maybe we may have missed some of the issues the CS has said. Because my understanding, and that is the clarification I sought, was that this isolation center is for preparedness, even to cater for Kenyans who may catch the disease, whether it is a staff of KCB, Equity Bank, or one of our armed officers who are working in DRC. Should they catch the disease, for instance, the military, the natural thing would be, if I was a commander-in-chief or the CDF, airlift anyone in an isolated manner to the airbase, to the isolation center there, to be treated there. But a truck driver, Honorable Speaker, who
Senator,
catches the disease in DRC, in Goma, and probably is detected at the Busia border. Is there a facility at the Busia border? Because I have read about the laboratory testing there. Maybe amongst the 23, the CS should also clarify, where are these other 23 centers to be established? Do we have them around the border with Uganda and where the trucks are passing, both legal and the illegal crossings? Because I see in his statement he's spoken about the legal crossings. But there are also illegal border points. What are we doing? Lastly, CS, on your preparedness, you have spoken about the contact tracing. We're at about 100%, 87% on laboratory readiness, rapid response teams at 90%, infection prevention and control at 56%. But you have also told us that we have kits for the first 200 suspected cases. And that is where preparedness comes in, Honorable Speaker, and I hope the CS can tell us, have you then prepared? Because I've also seen your request. You are saying the first 100 cases will cost about 2.686 billion. Is this money already provided for in the budget? Or should we, as we go to the budget process, now factor additional resources for this preparedness for Ebola? Because the first 200, if we learned anything from COVID, to get from 0 to 1,000 cases would take less than 3-4 weeks. Therefore, Honorable Speaker, I will just seek those clarifications. And Honorable Speaker, let me just close by saying this. Ebola is a dangerous disease from what we have seen. But as a country, we must be prepared.
And those isolation centers ought to be there, but they cannot be exclusively for others to use without Kenyans. And I think that's the very critical
Point
clarification. Because, Honorable Speaker, you know, in closing, this country, as Michael Joseph once told us, we have peculiar habits. Now, as politicians, many of us are very good experts in Ebola. And many Kenyans, almost all Kenyans are experts in Ebola. Let us hear from the experts, including the doctors here.
Waziri, let him respond to those. But before that, Minister, allow me to acknowledge your children, students in the galleries. In the speaker's gallery, we have Githunguri Girls School from Kandara, Muranga. We have St. Musingu High School from Ikolomani, Kakamega. Students, when your school is mentioned, you stand up to be acknowledged. In the public gallery, we have Kapsimbeyo School from Kuresoi South, Nakuru. USIU Africa, I believe there are students from Roysambu, Nairobi. Masjid Al-Amin Academy from Starehe, Nairobi. Gijiwe Methodist Fellowship from South Imenti, Meru. And Githurai Mixed School, Ruiru, Kiambu. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to Parliament. Minister, you can proceed to respond. Thereafter, we'll take another round, which will be the last one.
Thank you, Mr. Speaker. Mr. Speaker, I am ready to answer the valid questions by our honorable members, my colleagues. But Honorable Speaker, we are dealing with a very abnormal situation. And I want the House to look at the Public Health Act, Section 35 and Section 36. That mandates the Ministry of Health to take all the necessary action to protect and safeguard the safety of our citizens, our visitors, and all those who live within the borders of our country from any of the infectious diseases. To my sister, Honorable Sarah Koreri, but before even Honorable Speaker answer that question, first I think for information, we have 12 counties which are very high risk. These counties are Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, West Pokot, Turkana, Homa Bay, and Migori. And this is because of the air, the road, transport, and the northern corridor. Then we have got high risk. The first one was very high risk. The high risk counties are 13. These are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Makueni, Kilifi, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa. Honorable Speaker, again, for the information of the House, as of today, we have designated, verified 3 major hospitals as treatment centers. Kenyatta National Hospital, the Kenya National Police Hospital, MTRH in Eldoret. Secondly, we have also identified that we are in the process of completing the isolation, the treatment center of 2 hospitals in Busia. And I want to urge my sister, Mary Emase, even before COVID, the people of Busia and the country as a large, under the Ministry of Health, agreed that Alupe Hospital, a research center, is one of the very few infectious research hospitals. So in terms of qualification, that hospital is the most qualified because it's a research and infectious. Where have we done that? So in Busia, we have Alupe Sub-County Hospital, Referral Hospital, and we have Kocholie Sub-County Hospital. The reason why we picked on those two, you know, that is where the biggest crossing.
For the record, it's called Kocholia, not
Kocholia.
Kocholie.
Kocholia. That is where the epicenter in terms of crossing from either DRC, our tracks, and the movement are. But we are doing assessment of these sites in the following counties. And Honorable Speaker, under the Public Health Act, we don't need to do public participation. We are not going to consult citizens. Even members of parliament here, when they fall sick, they rush to their doctor to make sure they get the best treatment. So this epidemic does not require any consultation. Tomorrow, God forbid, if Ebola is found in this country, this house will call me back here to this chair to ask me why Kenyans dying. So before Kenyans die, before Kenyans are infected, we as a government have a moral, constitutional responsibility to protect both Kenyans and other people who are non-Kenyans who live within our border or who transit within our country. Honorable Speaker, on Laikipia Airbase is one of the 23 quarantine isolation center we are building. And we will not stop it. Why we are building? We are building in the airbase, far from even, and there are a number of reasons why. The runway in Laikipia is one of the longest runway. That is where we have KDF medical team. That is why even our 450 Kenyans who are serving today under the UN, our special forces, the quick response unit. I'm the speaker, I was the Minister for Defense. I went to Ituri. I know all those areas, those who have gone to Lumumbashi. Kenyans, the biggest hospitals in DRC are run by Kenyans, are owned by Kenyans. So we must protect, Mr. Speaker. So Laikipia will protect both Kenyans and the US. Honorable Speaker, when we had the COVID, and some of us were members of parliament here, the UN, the US, and many other international bodies built a hospital in Nairobi Hospital, a UN specialized hospital to deal with COVID. There was no noise that time. We have a responsibility to protect the residents.
Let him respond.
Honorable Speaker, on what the Secretary of State, Mark Rubio, said, that if it was said by the Minister, the Secretary of Health, I will respond. But I think that is an area for diplomats. The best person to respond to this House is the PCS. Because if it was my colleague, CS Kennedy, Alupe have answered very well. Laikipia we will build. Honorable Dini Nyoro, I think you are a bit very unfair. Because if all counties refuse to host isolation centers, the way you are suggesting, where will the Kenyans who will be infected, God forbid, go? I mean, as a leader, I don't think that way we can be irresponsible. And I agree with you, Madam Zamzam. Semen is part of the fluid. You are right. You are right. I saw people laughing at her. Body fluids. When we talk of body fluids, there are different types. Semen is one of the body fluids. So Honorable Ndindi Nyoro, I really want to urge you, my very good friend, if we say every county refuses, then where are we going to treat Kenyans? Are we going to treat them up in the air? We as a government have a responsibility. We can still even create another isolation center in one of our barracks in any part of the country. If today it was in Mordecai in Garissa, in Isiolo, so it will treat both Kenyans and foreigners. And please, let us not politicize it. The document that for the good of our country. It was good for our country. Kenya, Honorable Speaker, is number 2 in terms of healthcare delivery. South Africa is ahead of us. And very soon, even the US that you are praising, having a very good healthcare system, I can assure you, under the good leadership of President Ruto, we will become number 1 in healthcare delivery in another 10 years. Honorable Kimani, I have given all the 23 on our table of all the isolation centers, including let us not politicize the health of our citizens. And I want to ask a question, Honorable Speaker. A Kenyan who is in DRC crosses today. He passes through the scanners in Busia.
Minister, you are not here to ask questions.
Yes.
Give a hypothesis.
No, Honorable, I want to compare with the US one.
Yes.
If a Kenyan crosses and then the scanners don't detect as having Ebola, the incubation period for this disease is 3 weeks. He comes and joins his family and the community. After 2 weeks, he's found to be infected with Ebola. What is the damage that Kenyan can cause? You know, we must look at how to save the nation. So we are more concerned about Americans coming, but we are not concerned about even the thousands of Kenyans, truck drivers who pass every day, go on there. We are just focused. Let us not make, Honorable Speaker, this thing more of the Kenya Kwanza administration. The health of the citizens of our country is a collective responsibility. Those in government, those in the opposition. We can play around with anything else. Honorable Speaker, the Honorable Sarah Korere, there have been 16 other previous Ebola outbreaks in our country. This is the 17th one. So it didn't come with this government. COVID was not with this government. So, and then Ebola and all infectious diseases, they don't know borders. They cross. They can cross from anywhere. And we must make sure the isolation and treatment centers, including the one in Laikipia, are securely controlled. The environment, even within the Laikipia, in fact, because it's a military camp, is even more secure than the ones we are putting in the counties. Any one of us can be infected with Ebola, God forbid. Healthcare workers will be trained. Waste management will be done. Honorable Speaker, Honorable Mary Emasi have answered a question. Honorable Ndindi have answered this question. I think there was Honorable Zamzam under the International Health Regulation Act of 2005, which this House has adopted. We are obligated. We are part of the global community. We are part of the global health security. Kenya is celebrated as one of the key leaders in global health security. We are obligated not only to take care of our own, but we are obligated to treat, to detect, and make sure even those who are not Kenyans, but who are within our border, must be taken care of, so that we are not safe until all of us are safe. I think the Honorable Deputy Minority Leader, my old colleague, the facility is receiving patients. What we have passed in the House was on infectious, biosafety, biological, which were all stipulated in the agreement. And Honorable Speaker, I have carried all the documents for this House. It was there before. You can get it from the Hansard, how it was passed, but I still have copies at the Ministry of Health. So quarantine is not only for Americans, even Kenyans will be isolated at the facility, and I have highlighted the huge Kenyan population in DRC and Uganda need our support. Honorable Speaker, I think most of the questions I have answered. The last one is, let our preparedness and response be dictated by science and not by politics. How we respond, how we protect our citizens from Ebola, which has no vaccine, it should be guided by science, but not politics. We'll go back to politics when we know the country is safe, the citizens are safe. And Honorable Speaker, finally, Nairobi is the center of the diplomatic community. The UN at Gigiri, the only one in the global south, extra 8,000 staff have been brought in the last 3 months. This is where we have the multilateral institutions. This is where we have JKI last year received 9 million visitors and about 3 million tourists. All those, plus our citizens, we must be cognizant of their health. Honorable Speaker, so Laikipia, Honorable Korere, the one on the land taken, I think it is this house again which has passed the agreement between us and our UK partners. So there's nothing illegal the government has done. Let's all of us be the voices and help us communicate to our constituencies that Ebola, and particularly this variant, is dangerous, it has no cure, and all of us must be vigilant and alert, and those of us in the health ministry, we will protect our citizens.
Order, Mary Emase. What is it, Emase? He has responded to your question. What is it you want to clarify? You want to
May I have
recount
the
what
mic?
you
Thank
said?
you, Honorable Speaker. Honorable Speaker, I do not want to be misunderstood. In Teso South sub-county, I have 2 sub-counties. The only hospital I have offering the normal medical services to the community
You said that
is
already.
Alupe. Honorable Speaker, my position and the position of the people I represent is that there is enough land in Alupe. Let the ministry build an isolation center for quarantine purposes, away from the hospital, but not to take the hospital for that purpose. That is what we are objecting.
Point made. You have made your point, Mary, and you and the minister are saying the same thing. Honorable members, order. Honorable members, the time I allocated has been overshot. Just hold your horses. Has been overshot by 9 minutes. Given the interest, and whoever I give, you just ask a question, no speeches, so that we can take another 10, 15 minutes, and you're obligated to extend from 10 by the time we are consuming now until we finish. Okay. I will give 3. Okay. Minority Leader Junet, you will be number 1 on this side. Number 2, I'll give Honorable Kiamba Susan. That is number 2. Number 3, I'll give the Chair of Health. This side, I'll give Professor Jaldesa, number 1. I'll give my Deputy Speaker, number 2. And I'll give Madenge, number 3. I've already given members of your committee. So let's start with number 1 in quick succession. Junet, I'll come to you. After Junet, Kiamba, after Kiamba, Nyikal, in that quick succession.
Mr. Speaker, thank you very much for giving. Mr. Speaker, I want to ask this. But having noticed that, Mr. Speaker, there is a ratified document by this House. Mr. Speaker, members should take very serious when the Speaker is putting a question of as many of that opinion say, you just say, you don't know you're ratifying something that's going to bring a disease. So be careful next time. Next time, be careful, please. But, Mr. Speaker, my question is, I have condensed this thing into two aspects, Mr. Speaker, and I want the Minister to clarify. What Kenyans are grappling with, Mr. Speaker, is how does the government intend to safeguard Kenyan sovereignty and decision-making authority? Just explain to the House how you have safeguarded your sovereignty and your decision-making. And then lastly, whether it is the foreign governments that will decide who gets admitted to those facilities, and whether you have done public and security assessment, and whether you have done that report public. If you answer those 4 questions, then Kenyans will be safe. Thank you very much.
Next, Kiamba.
Thank you, Honorable Speaker. I think my first one was point of order. Is it in order,
There is no
Honorable
first
Speaker?
one. I've given you to ask a question. A point of order arises when a member is on the floor. There's no member on the floor. Ask the question. If you don't, you yield the floor.
Thank you, Honorable Speaker. I would want to ask the Minister, now that Kenyans have spoken loudly and clear, that the context has changed and we no longer want this center, what is his recommendation? Does the wishes of Kenyans become irrelevant, or can dynamic Kenyans think, or once something is passed in this parliament, it's passed in heaven? Thank you.
Yes, Dr. Nyekal.
Thank you, Mr. Speaker. Mr. Speaker, let me ask one. Who will be admitted in this facility, and what would be the criteria for admission? 2, will people who are already sick be transferred to this admission? 3, will people other than Americans be admitted in these institutions? And on the contrary, will Americans be admitted in the other 23 institutions that were put in place? And why didn't we...
Nyekal, I gave you an opportunity for one question.
Okay, then
Then
let me just, I'll ask 3, I'll leave it there. But let me make a comment about the agreement, because I know the agreement. I remember every point in that agreement. It said, with mutual agreement. So, Mr. Speaker, I only wanted to make those 2 points.
What is the point of order, Carolo Mondi? What's your point of order?
Honorable Speaker, is it in order for the chair of the Health Committee to mislead the House and the nation that in those 2 agreements, which I have here and which I've read, there's a clause that provides for the establishment of an isolation and treatment center in case of any outbreak of Ebola or any other disease? There's none. I can read them out for you. If it is,
that.
show us, tell us the article.
Order, Honorable Carolo Mondi. Order.
Mr. Speaker, I say...
Dr. Nyekal, I heard you clearly. Take your seat. Take your seat. Carolo Mondi just wanted an entry to make an inflammatory statement. Yes. You never said that. Jaldeza? Jaldeza?
Here, thank you.
Order, Carolo Mondi. Nyekal never said what you are saying. I'm closer to him. And I listen to all of you.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. I want to tell the House that Kenya is lucky to be having the leading and the best researchers in this region. Kenya has been taking leadership in leprosy research at Alupe, which was an isolation center. Mr. Speaker, when HIV started, HIV patients were actually isolated until people learned that it's not such contagious disease. And it was based at Cambridge, and it has done very well. And the research work which was done and the researchers were left behind for the country. Mr. Speaker, last COVID was such a threatening disease that we were actually trying to look for beds for patients who have COVID. And people are going to all sorts of funny places, including some hospitals in Kibera, and it saved people's lives. But the good thing, the Nairobi Hospital East Wing The Nairobi Hospital East Wing was left behind for the hospital
Yes,
and for the
Orero,
country.
what is the point of order?
Oh.
He
Mr.
has a
Speaker,
point of order. Let's hear him.
is it right for my colleague to refer to Kibera as funny hospitals, even in Kibra? Is Kibra not a constituency?
Yes.
It's demeaning my constituency.
Go on.
Mr. Speaker, Kibera is a constituency, and it has the highest concentration of people in this country, and it deserves better services. Mr. Speaker, my point is this. Mr. Speaker, when this Ebola virus outbreak ends, what will be the benefit left for the country? That now we can say the country benefited financially in terms of resource and research from this outbreak.
Deputy Speaker.
Honorable Speaker, I would like the Cabinet Secretary to confirm to the members here who have objected to having the quarantine centers in their own counties that in our case, Uasin Gishu County is one of the quarantine centers. And because of our close proximity to Malaba border, we can be at risk and our people can be at risk. And that is the reason why we are not politicizing it. We are welcoming it because we know they'll take the necessary steps to make sure that we don't risk. And also, I want the Cabinet Secretary to also confirm to members that you're not going to endanger our health because of politics. This is a highly infectious disease. In fact, it can warrant calling of a state of emergency in the country. It is not a choice for people to make or a court process. The moment the country, people's health is endangered and livelihoods are at risk, we might not even be, you're not supposed to even question. So I think it's important to know that that is not something that is within our prerogative to say, I don't want this hospital, or I do not want that hospital. And for Honorable Karoli Omondi, if you look at page 5, you will see the participants intend to collaborate in the following areas: surveillance and outbreak response. What is exactly happening now is surveillance and outbreak response. All the steps that the Cabinet Secretary has read here are exactly those. Thank you, Honorable Speaker.
Madenge.
Thank you, Honorable Speaker. Honorable Speaker, I want to draw the Minister to the attention to the first agreement that was tabled in this House for ratification. On page 6, Article 3, Executive Agents and Implementing Agreements. For the United States, the agent responsible is the United States Department of Defense. And therefore, Honorable Speaker, the Minister cannot fail to respond to the words of the Secretary of State in saying that the United States will not allow Ebola-infected patients into their borders, because that is the issue that Kenyans are talking about. In Kenya, it is the Ministry of Health. So, CS, you cannot abdicate responsibility. Honorable Speaker, my second content, again on the agreement, is Article 11, page 11, that this agreement shall remain in force subject to Article 13.2 for a period of 5 years from the date of entry into force and the ratification by this House. There was no express, although there is a provision in 3, this agreement may be renewed for an agreed period upon mutual consultation and consent. In the approval provided by this House, did this House envisage that when I am talking about the approval by the House. The approval by the House. In the approval by the House, did this therefore mean automatically that then when the Cabinet then renewed, that extended the approval granted by this House? Lastly, Honorable Speaker.
I gave you an opportunity for one, Madenge.
Allow me just one. The committee recommendations, Honorable Speaker. Number 5, the implementing review committee be constituted and should develop a mechanism for reporting back to Parliament on the status of the implementation of this agreement. How many reports, Honorable Speaker, have been brought to this House on the implementation?
Minister, before you answer, let me give the minority whip, Millie. Millie,
thank you.
ask one question only.
Thank you, Mr.
Don't
Speaker.
make a speech.
No, I actually wasn't going to give a speech. You are the one prompting me. But I'm not asking.
I will stop you if you
I'm not asking. I'm not going to.
Go ahead. Millie.
Thank you, Mr. Speaker. Mr.
I've
Speaker.
given Millie on account of being your leader. Go on.
Thank you, Mr. Hey. Mr. Speaker, you can see Suberians are disturbing each other. Mr. Speaker, mine is really very, very simple. And if you listen to the concerns, Kenyans are not really too worried about setting up of centers that protect Kenyans. Kenyans are worried about the statement that was made by by Rubio from the US that seems to imply that this facility is for Americans to protect Americans so that the infected Americans do not touch American soil. And Mr. Speaker,
if you want my opinion, it was a very irresponsible statement.
yes, it was a very responsible statement.
Yes.
And all I want to ask Honorable Duale, even though he's throwing back this to the Ministry of Foreign Affairs, is what is he doing to deal with this issue squarely with America? We have seen our counterparts in West Africa when they're being bullied by the French, that they take a firm position and say no. So what are you doing to tell America that they are a friendly nation and we are friends to them, but we cannot allow a situation that compromises our own nationals to maintain that friendship? We cannot allow such things in Kenya.
Thank you. Last, Bukose.
Thank you, Honorable Speaker. Honorable Speaker, I want to confirm that when the report was tabled in 2016 by the Committee of Health, I seconded that report, and the chair was Honorable Nyamai. What I wanted to ask the Cabinet Secretary, what I wanted to ask the Cabinet Secretary, why are you laughing? No, it was Honorable Nyamai.
If it's a statement of fact, it remains a statement of fact.
It's a statement of fact.
Yes.
Honorable Nyekalu was a member of the committee. And Honorable Speaker, one funny thing about that report is that when we put into the dailies to ask for public participation, there was no single memorandum from the public. Nobody wrote anything. And I think Kenyans also need to be responsible. They must be able to look at some of this when the parliament puts a document for opinions or memorandum in the dailies, that they should also be able to give inputs. And therefore, honorable members who are not members of parliament by them cannot say that they were not Kenyans at that time. They needed to have even put their input. What I wanted to ask the Honorable Minister, Mr. Speaker.
Kajiado South, Parashina, what's your point of order?
Mr. Speaker, is a member in order to come to maybe to relate the public participation by then and what is going now is Ebola. So we're talking about the Ebola, the foreign, whatever is happening is the question is about Ebola. It's not about the agreement by that time.
I think you're wasting my time because you don't understand. This is the problem of not understanding what we were ratifying. Honorable Speaker, what I wanted to ask.
Honorable Junet, what is it? Hold your horses.
Mr. Speaker, Dr. Pokose should have given us more information that Dr. Nyamai was the chair and he was the vice chair.
Yes.
He put it like he was a member.
No, I
but,
was a
but,
vice
but, Mr. Speaker, just to...
He said he seconded.
Yeah, but he was the vice chair of that committee.
Yes.
Mr. Speaker, the fact of the matter that is coming out today here is that Parliament ratified this treaty.
Yes.
Mr. Speaker,
Yes.
let us be open to Kenyans. We gave them opportunity to give their public participation. We ratified. We told Americans, do what you want to do.
Yes.
And when the Speaker says, as many of that opinion say, aye, na
And we
umekula
said
wali
aye.
mingi, don't cheat Kenyans.
It is true what minority leader is saying. We ratified the agreement as the National Assembly. And it became the law of Kenya, because by ratification, what it means is that it becomes part of the law of the country.
Ask the question.
My question to the Cabinet Secretary. You know, when people are raising about the isolation centers being set up in certain areas, does it mean the whole hospital becomes an isolation center, or there is a specific area within the hospital that is set up as an isolation center? Because I think that is what Kenyans need to understand publicly, so that, like my colleague, when we talk about Koicholwa or Alupe, thinking that the whole of Alupe is an isolation center. So I think the Cabinet Secretary needs to clarify. Even as we speak of Kenyatta having an isolation center, what does it mean? Thank you, Honorable Speaker.
Minister, can you answer all those in 5 minutes?
Yes, Honorable Speaker. Honorable Speaker, let me start where Honorable Pukose left. That isolation centers are not part and parcel of the hospital where citizens access for other services. And it's not something only with Ebola. It is a standard procedure when an infectious disease happens, whether it is Marburg, Mpox, name it. So even in Alupe, in any facility, even in Laikipia, it is very far. Those who come from Laikipia know the expansiveness of Laikipia Airbase. It is far from the base and all the facility in the base. So no hospital. Honorable Chair, Honorable Junet asked whether the issue of our sovereignty. And in my statement I say, and I want to emphasize, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners and governments, including the US, they provide technical assistance, they provide health commodities, they provide finance, and I want to thank the US government, the only one so far, apart from WHO, who has provided 1.7 billion for just only Ebola. They provide training and logistic support within the framework approved by the Kenyan authorities, and which is consistent with the Kenyan laws. So, Honorable Junet, I want to assure you that all the facilities which are being established, including the one in Laikipia, for the protection of the people of Kenya and all persons within the Kenyan's borders, they are not foreign facilities. They are not exclusive facilities. They are not facilities reserved for any nationality. They are public health assets established and coordinated under the authority of the government of Kenya. Honorable Speaker, Honorable Sholei, I think, made it very clear. We have a moral responsibility. Every county where we are setting isolation, quarantine, treatment centers, they are based on science and the law. And it's done by experts who are Kenyans. Honorable Madenge, you are a member of the health committee. You know that I have never shied away or abdicated my role as a Minister for Health, and I'll never do it. But this agreement first was signed by Minister Macharia. It was again extended by my very good colleague, the current Minister for Agriculture, Kagwe. And when an extension is being done, it only requires one ratification by the House. So the House has passed, the way we have passed many other many other agreements, and this is all to protect our people. Honorable Nyikal, Kenyans will have a priority in admission to any of the centers, including Laikipia. And we should not be very much preoccupied just one center. I don't know what is so fast about Laikipia. We have 23 centers. Even in my own backyard in Garissa, it's one of the counties. Tomorrow, if we agree to put it, and we're going to put it, the people of Garissa will be saved. So we have 23 centers, Laikipia included. And Kenya is one, and let us promote one Kenya, one health, and we protect Kenyans regardless of where they come from, regardless of their counties. We need the isolation quarantine centers, Honorable Speaker, first and fundamentally, morally and constitutionally, to protect our citizens, Kenyans. Again, also to protect other people who live or who come through our country. But for our partners who have signed the agreement, they can access these centers. Americans can access any of the centers. Of course, Laikipia is one of the centers they have jointly worked with the Kenya Defense Forces. Honorable Speaker, Honorable Susan talked about loud and clear. I don't know, I can't answer what is loud and clear, because Kenyans, when they want to make their choice, they do it through a referendum or through public participation, not through demonstrations. And the health of our citizens cannot and will not be decided by 3, 4 people, 10 people who will demonstrate outside MOH. Tomorrow, even Ebola, God forbid, finds itself in our country, the person and the people who will be held responsible is the current government. And we must do whatever it takes to protect the citizens of our country. Honorable Speaker, Honorable Jalesa and Honorable Jalesa, I think, he said we did this. We have the best capital.
Jaldesa didn't ask a question.
Yes, Honorable Millie. Please, my good, we join Millie, Honorable Millie, together to this House of Excellence, Honorable Speaker. Don't compare us with some other places. We are ahead. We are number one in the healthcare. We have a very good relationship with the US. They spent $8 billion. Today, the gains we are proud of in HIV, in AIDS, in malaria, in the capacity of the laboratories in Kisumu, like Cambry, CDC, Walter Reed in Kericho. Those were built because of the partnership we have with the US government. For Mark Rubio, I think Senator Mark Rubio, the Speaker, has spoken about it. He's a former long-serving Kenyan foreign minister. He understands diplomacy better than me. I've never been a diplomat. Thank you, Mr. Speaker.
We'll end there. Yes, Nyikal. Which one?
Will people who are already sick where they are be transferred to this unit? Mr. Speaker, I ask that question because science and international practice is when people are sick of a disease in a pandemic or an epidemic, you treat them where they are. You don't move sick people to a place where there's no disease. I would want a question to that. And Mr. Speaker, let me also say, this agreement does not oblige the government to put an Ebola unit. This agreement was general.
Yes.
Honorable Speaker, even to Honorable Nyikal, even here members are sitting. We transfer our patients from one hospital to another hospital. Why do we do it? Because we want them to get better care. The healthcare system, and I don't want to be misquoted, the healthcare system there and the healthcare system for a Kenyan who gets sick. I am sure all of you sitting here, if your next of kin gets Ebola in DRC, the first thing you'll do is to bring to a better healthcare system in Kenya. Honorable Speaker, and I don't want to talk about hypothesis. As of today, there's no Ebola outbreak. So don't take me to a situation where I discuss about people who are infected with Ebola. When that comes, then the House can call me back and ask me that question. That, are you bringing in people who have Ebola? As of today, there's no Ebola patient in Kenya. When that time comes, I am around, the House can call me back.
And there, honorable members, we'll now go back to order number 8. It is now 4, you'll call it, well, it's now 4:23. This second allotted day will end at 7:23. And the next allotted day will end at 10:23:25. Call out the next order. Minister, you are released to go back to your office.
Order number 8, motion, consideration of the budget estimates for the financial year 2026-2027, general debate, second allotted day.
My record shows the Honorable David Ndakwa, member for Malava, had 6 minutes to go. Ndakwa, you have the floor.
Thank you, Mr. Speaker, to have given me this opportunity to continue with the debate on the consideration, the estimates for this financial year, 2026-2027. As I had done my first point, Mr. Speaker, I would like to emphasize on the youth funding, which is an empowerment programs for the youthful Kenyan population, which is a potential that remain underutilized. Mr. Speaker, to the little economic and employment opportunities, we must allocate more resources towards vocational training, enterprise development, innovation hubs, sports and digital skills. Mr. Speaker, we need to offer youth affordable credit facilities so that they can empower themselves where the employment is scarce in our country. Mr. Speaker, sir, empowering our youth is not just about expenditure. It is about investment of this country into the youth, which is for the future and the prosperity of this country, looking at the stability of the economy. Mr. Speaker, I'd like to comment something on education, whereby an educated society is empowered. An empowered society, Mr. Speaker, in the nature that we strongly advocate and enhance the funding of this education sector. Mr. Speaker, sir, education remains an equalizer to our standard of life, and most effectively is a tool in fighting poverty and also creating job opportunities. Looking at this budget, Mr. Speaker, we look at the allocation and find that it has been given a substantial amount of 789 billion towards education. Mr. Speaker, sir, this is a good gesture on infrastructure development. Mr. Speaker, sir, on the recruitment of teachers, whereby we need to have GSSC teachers to be confirmed because they are serving on contract. Mr. Speaker, sir, we are looking at the allocation of bursary, whereby the needy students are to be helped to enhance in their academics. Mr. Speaker, sir, bursary also as a conduit for getting to understand the measure of academic in our law society, the much that is given to education should be given a latitude in bursaries, whereby bursaries in our constituents is also giving lifeline to the law earners in our society. Mr. Speaker, sir, we need digital learnings to be enhanced and also some improvement in learning environments, not just in local areas, but also in urban areas. A denied child to access education is a disservice, because for equity in understanding what education is all about, to acquire knowledge, Mr. Speaker, we need quality education and we need financial constraint. Mr. Speaker, sir, looking at this budget on healthcare, healthcare has been given an allotment, Mr. Speaker, that I find to be well, depending on the primary healthcare, Mr. Speaker. An improved access to healthcare, Mr. Speaker, it can keep some good survey in equipped hospitals, whereby health centers, like where I come from, Kamchisu dispensary, has got its alignment to understand and be given a leeway to make sure that we are accessing health facilities with no difficulties. Unemployment given to our medical practitioners, Mr. Speaker, sir, where they are not motivated, you will find that their working condition is very poor, which is leading to demoralization. Mr. Speaker, sir, we need to strengthen universal health care, because most of our vulnerable in the society are the one getting pressure to tip into their pocket for them to get treatment. Mr. Speaker, sir, we have been talking about Ebola.
Martin Owino, did you speak to this? Okay, get yourself out. Victor Koech. I'm following the screen.
Thank you. Thank you so much, Honorable Speaker, for the opportunity as well to contribute to the motion that is before this House on the consideration of budget for the financial year 26-27, Honorable Speaker. I will constrain myself, Honorable Speaker, to the most of the basic needs. And as to why I say so, Speaker, is because where I come from and where we, members of the rural constituencies and single constituencies that we come from, Honorable Speaker, there are basic needs that still require proper budgetary consideration. Honorable Speaker, on matters education, as far as we are happy with what the Department of Education is doing and are planning to appropriate good monies to infrastructural development, Honorable Speaker, it is very paramount for this House, Honorable Speaker, in the future to as well consider the constituencies that are believed to be underdeveloped. Because, Honorable Speaker, a constituency like Chepalungu constituency that has 187 primary schools that are registered, that has 97 day secondary school that are registered, Honorable Speaker, that is a 5-ward constituency and getting an allocation of 192 in CDF, Honorable Speaker, it is paramount and it's reasonable that the budget and the chair for budget is here, and I'm happy he visited Bomet County, the first ever budget chair to visit Bomet County. He was there in person, he listened, he went through the proposal that we gave him. And I have a belief that he understood the reason where we're coming from, that Chepalungu constituency and other rural constituencies require affirmative action so that our students can be able to compete fairly. Because, Honorable Speaker, they say education is an opener. and it's an equalizer. Failure for rural constituencies to have basic infrastructure like the laboratories, like the libraries, like tuition block classrooms, Honorable Speaker. That is why we call upon the Department of Education, together with the chair for budget, to be considering such constituencies like Chepalungu constituency. Honorable Speaker, when you talk about TFET, we know the steps that TFET has put, the efforts that is being put by the TFET department in enhancing and in disseminating knowledge, the skills, the basic skills. There are other constituencies like my constituency, Chepalungu, that has an incomplete lab. And that is why we always run to the budget committee to ask if we can at least get some few shillings to complete such infrastructure. But Honorable Speaker, there's something that has been crossing my mind for so long. Because we give free registration, free examination fee, courtesy of the government, to the grade 12, let me say to the Form 4s. We also give it to previously under 844 to class 8. When it goes to the tertiary level, and I'm specific to TVETs, Honorable Speaker, a student or a learner who wishes to sit for exam is being asked to pay to a tune of 12,600. These are amounts, Honorable Speaker, that we've been discussing and encouraging that the Ministry of Education, through TFETs, if it is possible, they can also give free registration to these particular learners so that they do not fall or drop out of school because of lack of examination fee. Honorable Speaker, when I come to electricity, Honorable Speaker, we have had various debates on how we appropriate these monies. Honorable Speaker, a rural constituency in Turkana, a rural constituency in Kisumu, a rural constituency in Bomet compete for the same limited resources like an urban constituency that has a better electricity connectivity. Honorable Speaker, we have always called upon anyone who is relevant to at least consider affirmative action for constituencies that are still below 20% in terms of electricity connectivity. Honorable Speaker, when some of us were elected, we were below 15%. The much that we've tried, no one is able to appreciate, simply because the demand versus the supply is too huge, Honorable Speaker. And that is why all the time we find ourselves in the ministries, we find ourselves with the chairman for budget, trying to at least argue our points that these rural constituencies have to be given proper support in terms of affirmative action. Honorable Speaker, when it comes to other basic needs, that is water and health, I am happy that this government, that this House is appropriating proper finances so that the health care, that is the Social Health Authority, is being given proper consideration so that our people can be able to access free and cheaper and affordable health services. Honorable Speaker, I want to end there by saying at least this particular financial year, we are able to, when, at times, Honorable Speaker, when we sit here and you put a question like, do as of the same opinion say hi, we normally say hi, whereas we appropriate money to go and to develop other constituencies. At least for this financial year, when we were saying hi, Kapkwen, Shongiroi Road that is going up to Ndanai is in the budget. At least when I'm saying hi as a member of parliament, a road that is linking from Chebole that has been a problem, going to Chebunyo, going to Emurwa Digir, is considered for rehabilitation. At least today, Honorable Speaker, when I'm saying hi, water that is from Posta has been given proper consideration. At least, Honorable Speaker, today when I'm saying hi, there is proper money that is being appropriated to education, to go to support and to confirm our interns who have been serving there for so long, Honorable Speaker. Honorable Speaker, allow me to end there and say I support. Thank you.
Robert Mbui.
Yeah, thank you, Mr. Speaker, for this opportunity to also make my contribution on the budget of this financial year. Mr. Speaker, first and foremost, I just want to demystify this issue of budget, because many times Kenyans will be glued on their screens looking at what is happening here and looking at the budget like it's a very major issue. But budgets are very basic, Mr. Speaker, because the budget just deals with the expenditures, and it's the same. Personal expenditures also are budgeted. Family expenditures are budgeted. Expenditures of organizations, businesses are also budgeted. So it's the same thing that the government does. And Mr. Speaker, there are certain basic things or basic principles that all budgets must adhere to, and that's what any budget has to have. And Mr. Speaker, those are the things I want to talk about and point out where I feel that this budget has succeeded and maybe also failed. Mr. Speaker, the first thing is that we are spending a lot of our money dealing with the issue of public debt. And Mr. Speaker, it is quite unfortunate, because it is many times leaders have spoken about public debt, not just this regime, even the previous one. And Mr. Speaker, it's unfortunate because I remember a while back, before the last election, I remember leaders telling us that, when you are in a hole, you stop digging. And Mr. Speaker, unfortunately, we are digging even faster and deeper than the hole was. In fact, right now we have submerged ourselves. We are invisible, Mr. Speaker, because we are completely in the hole. I don't even know how we are going to get out of this hole. The kind of percentage of the money that is allocated to this country that goes into paying debt is just too much. It's astronomical. And Mr. Speaker, we must find a way to reduce this. But Mr. Speaker, there is also the matter, Mr. Speaker, of pending bills. Mr. Speaker, we have an issue. A lot of Kenyans have invested in doing business with the government. And it's not just even at the national level, even at the county level. And they are owed so much money, in excess of 60 billion. Mr. Speaker, I ask myself, that money, if it was released to go back into circulation, obviously that's how the economy grows, because then we have money that is being spent, and therefore we can be able to grow our economy even faster. But Mr. Speaker, the money is tied. People have done business, they have not been paid. People have committed suicide. People have, it is so unfortunate. And Mr. Speaker, what surprises me is that almost every year, we always insist that, we'll set aside some money and make sure that we sort out the issue of pending bills. How many times are we going to have our grandchildren come to this house and continue that discussion? We must reach a point and bite the bullet and say we must sort out this thing once and for all. And Mr. Speaker, we also have to find out, what do we do with those government officers that have spent beyond what they are supposed to spend? Because what is it that causes spending bills? Maybe there are some people that give contracts or jobs when there is no money to pay. So, Mr. Speaker, we have to be careful as a country so that we don't continue endangering our people. It is a song that we have sung. We must stop the singing now and make sure that we take action. Mr. Speaker, there is also the issue of prioritization. How do we prioritize our expenditure? Mr. Speaker, sometimes I look at the budget and, you find that there are certain areas, because even in your own personal budget, you will prioritize. You will look at those expenditures that you must, like you must pay for your rent, you must pay for your children's fees, you must buy food. Those are a must. Those are recurrent expenditures that you must do. Then you will, whatever remains, then you can endeavor in doing some kind of development. You cannot start building a house when you don't even have money to pay for children's food. So, Mr. Speaker, the prioritization here is strange, because you look at the kind of budget that, for example, will allow State House and the office of the president, and then you ask yourself, how do we spend that kind of money when we have teachers, intern teachers that are being paid peanuts? And then we expect, and they say if you pay peanuts, you get monkeys. How do you expect teachers being paid, underpaid so badly, to go to those classrooms and teach our JS children? So, Mr. Speaker, and then again, look at the number of teachers. There is a shortfall, there is a shortage of the number of teachers. Why is it we are spending so much money in luxury? Any money going into public offices is basically for luxury. It is for tea, for mandazi, for any entertainment money. Is money that we can do away with, so that we can be able to provide funds that can be able to move the country forward. Mr. Speaker, even when it comes to issues to do with development, because the development has to be done, we have to also be careful, Mr. Speaker. How do we develop the country? Are we developing across the country, or are we segregating and developing certain areas and leaving others? Mr. Speaker, I have looked at that budget, and Mr. Speaker, I am a member of parliament representing a constituency called Kathiani in Machakos County. And I must say that the only project that has been in this budget for over the years that directly touches on my constituency is just one road. That one road, which was worth 1.6 billion, started in 2017. Every year you get peanuts, peanuts, peanuts. Mr. Speaker, even the allocation that we'll get will not take this road anywhere. It's only one road. But there are members who have stood. A member has stood on the floor, and I don't want to name members because that would be unfair. And they've talked about the projects in their constituencies. Mr. Speaker, I want to understand, does it mean that these areas...
There is a point of order from the chair budget.
Honorable Speaker, thank you very much. I respect my leader here, but I wanted him to give me the details of the road he's talking about. The reason I'm asking is because, Honorable Speaker, we have a comprehensive program for road network in the country, where all roads are being improved, and there's no contractor who is outside site as we talk. So I'm keen to see that road so that I can see whether it's being factual or not. Because, Honorable Speaker, from the resources we have in the budget and even from the securitization, we have been able to ensure that all road contracts are going on smoothly. Honorable Speaker, if the leader could be able to share me the details, I'll be able to respond to that is concerned. Because the principle of this government is not to segregate any part of the country. Thank you.
Thank you. I'm happy. Yeah, thank you. I'm happy the chair of budget has indicated that he would be in a position to help. It's a road from Keno through Mitaboni, through Kathiani, all the way to a place called Kaani. Contract given in 2017, and it is even now. I mean, right now there is no contractor on site. Mr. Speaker, these are facts because even not just my place, there are many roads that are stalled all over the country. And the reason I raise this is because there are certain members that are celebrating their areas and they are very happy about the projects they've gotten, the dams and the roads and all that, at the expense of others. And that's why I'm saying that as a house, we also have to take control. I think the biggest mistake we make as a house is to allow influence from outside to make the decisions on our behalf. Because if we sat and shared out equitably and fairly, then we'll be able to develop the country across, and all of us would be able to get a project or one or two projects. So, Mr. Speaker, my concern is that the distribution of resources across the country has been unfair, and I think, Mr. Speaker, that is something we need to address as a nation, so that going forward, this House can take the power that it has been given by the Constitution, make the budget, and ensure that we take care of the interests of the people that we represent. Mr. Speaker, Mr. Speaker, I've noted that, and I'm sorry to say this, that a lot of times we have been coerced to visit other offices so that we can get development in our constituencies. And I'm speaking this because it is important for this House to take charge. I want to ask that and plead that as we go into the future, when it comes to matters budget, even if the Treasury proposes, let us listen to one another. Let us listen to one another. Let us come up with a budget that touches on all corners. You know, when it comes to development, Mr. Speaker, just like personal budgets, you must develop an area because there is an economic benefit that is coming out of there. There are some far-flung parts of the country that will get more allocation than areas that are even more deserving. Places where money will be invested, and you can see absolutely no return for the investment. So, Mr. Speaker, I want to talk about that issue of equitable distribution of resources. Let us be fair. Let us ensure that it is not just Kenya Kwanza regions that are being supported. Even Lower Eastern is part of Kenya, and every part of Kenya deserves a big share or the fair share of the budget. Thank you, Mr. Speaker, for that opportunity.
John Makali.
Give me the mic. Oh, thank you, Honorable Speaker, for the opportunity to also weigh in on these budget estimates for the financial year 2026-2027. At the outset, I will thank the Budget Committee for spending hours to work up on this particular report. Speaker, in the interest of time, I have 4 critical issues I want to address, which are critical to our national development. The first one is is on the State Department for Roads. Honorable Speaker, in this particular budget, we have allocated a sum of 228 billion towards maintaining the roads for the financial year 2026-2027. Honorable Speaker, roads play a very, very, very critical role in our national development. They facilitate access to markets, they attract investment, they provide employment opportunities. How I wish, Honorable Speaker, that we will have allocated more money on roads, because, Honorable Speaker, all over the country, we are having a very, very big problem with our roads. In my constituency, Honorable Speaker, you know we have problems with the common C41, the Navaholo, Muskoma, Dorofu Road, which is a big, big problem. But I'm aware, Honorable Speaker, we passed the infrastructure fund, National Infrastructure Fund. We are hoping that during this financial year, we should be able to operationalize that fund so that it can be able to assist in the maintenance of our roads. Yes. As I commend the allocation on these roads, Honorable Speaker, I want to state 4 things to the committee and to this House at large. First, we need to prioritize the completion of stalled road projects that are giving us really a bad name. 2, we need to enhance maintenance of existing roads networks to protect previous investments. That is very, very critical. And finally, also, ensure equitable distribution of road projects across the country. Honorable Speaker, you will hear in some places they have an allocation of 20 billion shillings on account of roads. And you find an area like Western where you only have maybe an allocation on account of roads around only 10 or 12 billion only. We want equity in the distribution of sums of money set aside towards construction of roads. I also support the operationalization of National Infrastructure Fund because it will be critical in removing the pressure on the budget in respect of these particular roads. The second item which is critical to our national development is agriculture. In this particular budget, Honorable Speaker, we have allocated a sum of 79 billion shillings towards agriculture. Agriculture is very critical to our economy because 20% of our gross domestic product is account of agriculture. 40% of the employments in this particular country are from the agriculture value chain. But Honorable Speaker, we will want to point out 3 things. While appreciating the steps we have made, I know we have made very serious strides in fertilizer subsidy. We have also made a provision for seed subsidy. Those are very, very good strides. We have also made very serious strides in agricultural research. But I will want to propose 3 things. 1, we started up with the sugar reforms. And all the public sugar mills were listed out. But we have not already completed that part of the sugar reforms. I'm happy that in this particular budget, we have allocated 2.47 billion shillings towards settling of the employees' arrears. I will be urging the committee as it retreats back. There were employees who were sacked specifically from employees from Zoya Sugar Company and the other public sugar mills. For us to ensure that all these employees have a good time, we need to allocate more money to ensure that we clear those arrears that were due to employees and farmers so that they can also be able to have a livelihood. But of that, we will want to insist that the government needs to do several other things. 1, ensure timely provision of subsidized fertilizer. We find many, many times you go to National Cereals Board, you find farmers are queuing, and there are long queues. At times the fertilizer is not available, or if it's available after the season, to ensure timely provision of subsidized fertilizer. 2, strengthen agricultural extension services. The county governments, I know agriculture is a default function, but our county governments have not been very, very good in supporting agricultural extension services. We will want to urge that the county governments pull up their socks in terms of agricultural extension services. Equally, Madam Speaker, we are spending quite a lot of money on imports. We are still importing a lot of rice, we are still importing a lot of wheat from outside. We need to strengthen our agriculture sector by ensuring that we have sufficient provision of funds to it. Because in this budget, it's only 3% of the total national budget that has been allocated to a very critical sector like agriculture. And in agriculture, 3 critical things come to the fore. 1, food security. 2, reducing imports and increasing exports. In this particular budget, we have only allocated 79 billion shillings. I find that sum is still a small sum, taking into account that we are also signatories to the Malabo Accord, which clearly indicates that at least 10% of the budgets should go towards strengthening agriculture. So, Madam Speaker, we'll be urging that the government looks into allocating more resources towards the agriculture sector, because that is our lifeline. When it comes to education, Madam Speaker, I want to commend the committee for allocating the largest chunk of the money in this particular budget towards education. But, Madam Speaker, there are a few critical things which I thought we needed to look into. And one of them is ensuring that there is timely release of capitation funds. Every time we go back to our constituencies, the teachers are complaining capitation has not been released. It's one thing to allocate funds towards a specific project, but it's another thing to have that money released. Teachers are actually complaining. So we will be urging that as a house, we keep on pushing to ensure timely disbursement of capitation funds to schools. To address infrastructure gaps in learning institutions. There has been an equity in distribution of infrastructure funds. I hope as we pass this particular budget, we are going to ensure that there is equity in the distribution of infrastructure funds in schools. We support the recruitment of teachers, and I think we must thank the government for employing, I think, 100,000 teachers. We are going to employ another 20,000. But we need to ensure that as we distribute those teachers, we distribute them evenly so that there are no shortages of teachers in some places, and we find some places teachers are many than other places. So we need to ensure that even if we employ these teachers, there is equity in their distribution to various places. Because you can find some places there are more teachers, in other places there are no teachers. Then TVET institutions. As we push the idea for TVET institutions, we must ensure that those institutions also work on courses that meet the market. Because we find many other institutions are churning out students who are not fit for the market. We need to strengthen to ensure that the graduates from these TVET institutions actually meet the target. Who are the winners in this particular budget, which I want to thank the budget committee? At long last, our village managers are going to have something to take home, however little. Our village managers, I know an allowance has been proposed for 3,000 shillings. I will say that is a good start we need to support, and eventually we'll need to up it up. Two, our electoral, we are moving towards the elections. The IEBC has always been complaining of not being funded adequately to ensure that there is adequate preparedness for the elections. If you move around over weekends, you can see the heightened political activity. We hope the funds that have been allocated to IEBC will be sufficient for them to engage in serious electoral preparedness, because this is, I think, the last budget, not the last budget, but the most crucial budget before the 2027 elections, so that the IEBC does civic education, voter registration, and ensure that the polling stations have been clearly marked out. Equally, from this, we will wish to thank the committee also for looking at confirmation of the JSS teachers. The committee has made a recommendation to have 20,000 teachers confirmed. How I wish you will have confirmed the entire 44,000 teachers who are on internship in JSS and have them, all of them confirmed. But moving forward, we can have a very, very nice budget. But, Madam Speaker, as a House, we need to also pull up ourselves to ensure that we monitor the usage of these particular funds. Because if we do not, then we could just have sums of money distributed on paper, but we are not monitoring up the usage of these particular funds. Because every time we move out in our constituencies, you'll find people are saying funds have not been used, programs that were actually budgeted for have not been executed. We hope that this time round we are going to do our oversight role as much as we can, so that we can ensure that the public funds are put to good use. I support, Madam Speaker.
Honorable Member for Tindiret.
Thank you, Madam Speaker.